Living with diabetes can be challenging, but it doesn't have to mean a life of constant restrictions and stress. If you're someone who struggles to manage your blood sugar levels, or you're simply looking for ways to lower your A1C and improve your diabetes management, you've come to the right place. What if I told you that small daily habits could make a huge difference in managing your diabetes? From diet adjustments to exercise routines and stress management, these changes can help you achieve better blood sugar control and reduce the risk of long-term complications. In today's video, we're going to dive into simple daily habits you can implement that will help you lower your A1C, improve your overall health, and make diabetes management easier. Let's get started. Understanding A1C and its importance. Before we discuss how to manage your diabetes, it's important to understand A1C and why it matters. Your A1C level is a measure of your average blood sugar levels over the past 2 to 3 months. This test is crucial because it gives you and your doctor a clear picture of how well your diabetes is being managed. What is a healthy A1C level? For most people with diabetes, an A1C level of 7% or lower is the target. However, your healthcare provider may adjust this target based on your age, health conditions, and individual circumstances. If your A1C is higher than your target, it indicates that your blood sugar levels have been consistently elevated over time, which increases your risk of complications like heart disease, kidney damage, nerve damage, and vision problems. Lowering your A1C is essential for reducing the risks of complications and living a healthier, longer life with diabetes. Now, let's talk about practical steps you can take every day to manage diabetes and lower your A1C. 1. Monitor your blood sugar regularly. One of the most powerful tools for managing diabetes is to keep a close eye on your blood sugar levels. Frequent monitoring helps you understand how your body responds to food, exercise, stress, and other factors, allowing you to make informed decisions about your diabetes care. How to do it? Check your blood sugar levels at regular intervals throughout the day. This may include before meals, 2 hours after meals, and before bedtime. Keep a logbook or use an app to track your blood sugar levels. This will help you and your healthcare provider spot trends and adjust your treatment plan if needed. Use a continuous glucose monitor, CGM, if prescribed by your doctor, which will help you track your blood sugar in real time without needing to test as frequently. 2. Follow a balanced, diabetes-friendly diet. A healthy, balanced diet plays a significant role in managing blood sugar and lowering your A1C. The foods you eat affect how much glucose enters your bloodstream, so it's essential to make choices that help keep your blood sugar stable. How to do it? Carbohydrate counting. Pay attention to the amount and type of carbohydrates you consume. Focus on complex carbs, such as whole grains, vegetables, and legumes, which release glucose more slowly into the bloodstream. Incorporate fiber-rich foods. Fiber helps control blood sugar levels by slowing digestion and preventing sharp spikes in blood glucose. Include foods like leafy greens, beans, whole grains, and berries in your meals. Choose healthy fats. Healthy fats from sources like avocados, nuts, seeds, and olive oil can help improve insulin sensitivity and lower inflammation. Lean protein. Incorporate lean proteins such as chicken, fish, tofu, and legumes, which help regulate blood sugar and keep you feeling full longer. Foods to avoid. Sugary foods and drinks. Limit the consumption of sodas, candies, and baked goods high in refined sugars, which can cause rapid spikes in blood glucose levels. Highly processed carbs. Avoid white bread, pasta, and other refined carbohydrates, as they are quickly converted into sugar and can lead to blood sugar imbalances. 3. Get moving. Regular exercise. Exercise is one of the best ways to help lower your A1C and improve insulin sensitivity. Physical activity helps your body use insulin more efficiently and promotes the uptake of glucose into your cells for energy. How to do it? Aim for at least 150 minutes of moderate intensity exercise per week, or about 30 minutes a day, most days of the week. Activities like walking, cycling, swimming, or dancing are great options. Include both cardiovascular exercises, such as brisk walking, and strength training exercises, like lifting weights or using resistance bands, to maximize the benefits of exercise. If you're new to exercise, start small and gradually increase the intensity and duration as you build stamina. Be mindful of how exercise affects your blood sugar. Check your levels before and after your workouts, and adjust your diet or insulin if needed. 4. Stay hydrated. Drinking enough water is often overlooked when managing diabetes, but staying hydrated is essential for blood sugar regulation. Proper hydration helps the kidneys flush out excess glucose through urine, preventing high blood sugar. How to do it? Aim to drink at least 8 glasses, 2 liters of water daily. If you're active or in a hot climate, you may need more. Avoid sugary drinks like soda or fruit juices, as they can cause spikes in your blood sugar levels. Herbal teas or infused water can be good alternatives to plain water if you need variety. 5. Manage stress effectively. Chronic stress is a major contributor to blood sugar imbalances. When you're stressed, your body releases stress hormones such as cortisol, which can increase blood glucose levels and impair insulin function. How to manage stress? Practice relaxation techniques. Consider meditation, deep breathing exercises, or progressive muscle relaxation to reduce stress and lower cortisol levels. Yoga. This mind-body practice can help you relax, reduce anxiety, and improve blood sugar control. Time management. Organize your daily tasks to reduce stress. Planning meals and exercise ahead of time can help you stay on track. 6. Prioritize sleep. Sleep is crucial for overall health and well-being, but it's especially important for blood sugar regulation. Poor or insufficient sleep can make it harder for your body to manage blood glucose levels and increase your risk of insulin resistance. How to improve sleep? Aim for 7 to 9 hours of quality sleep per night. Stick to a regular sleep schedule, even on weekends, to help regulate your internal clock. Avoid caffeine, heavy meals, and screen time, like phones or TVs, before bed to improve your sleep quality. Create a relaxing bedtime routine, such as reading, stretching, or taking a warm bath, to signal to your body that it's time to wind down. 7. Consistency is key. Track your progress. One of the best ways to manage diabetes effectively and lower your A1C is by tracking your progress regularly. Whether it's monitoring your blood sugar levels, keeping a food journal, or tracking your exercise routine, staying consistent and keeping detailed records will help you stay on track. How to track progress? Use a blood glucose meter to check your levels regularly and identify any patterns or changes. log your meals, exercise, and stress levels to see how these factors affect your blood sugar. Consider using apps that track food intake, exercise, and glucose levels, making it easier to manage your diabetes. What to expect when you manage diabetes better? By incorporating these daily habits into your routine, you'll likely begin to see improvements in your A1C and overall health. Here's what you can expect. 1. Lower A1C. Consistent monitoring, dietary changes, and exercise will likely result in a gradual reduction in your A1C over the course of a few months. 2. More stable blood sugar levels. By avoiding blood sugar spikes and crashes, you'll experience more consistent energy levels and better overall well-being. 3. Reduced risk of complications. Better management of blood glucose can help reduce the risk of long-term complications, such as kidney disease, neuropathy, and heart disease. 4. Improved quality of life. By taking control of your diabetes, you'll feel more empowered, less stressed, and more in control of your health. Empowering yourself to manage diabetes better. Managing diabetes doesn't have to be overwhelming. By implementing simple daily habits like regular blood sugar monitoring, balanced eating, consistent exercise, and stress management, you can take control of your health and lower your A1C over time. These changes don't just improve your blood sugar levels, they also help you live a healthier, more fulfilling life. Remember, consistency is the key to success. Even small, positive changes can lead to significant improvements in managing your diabetes. Start today and take the first step toward better blood sugar control and a healthier future. Advanced strategies for managing diabetes and lowering A1C. While the daily habits we've covered are foundational for managing diabetes and lowering A1C, there are advanced strategies you can incorporate to take your diabetes management to the next level. These include advanced medical treatments, supplements, and behavioral changes that can provide even more support for blood sugar control. 1. Advanced medications for diabetes management. For many people, lifestyle changes alone may not be enough to bring A1C to desired levels. In such cases, medications can play an important role in controlling blood sugar and preventing complications. There are several classes of medications available for diabetes management, each targeting blood sugar control in different ways. Common diabetes medications. Metformin. One of the most common medications for type 2 diabetes, metformin helps lower blood sugar by improving insulin sensitivity and reducing glucose production in the liver. SGLT2 inhibitors, such as canagliflozin and dapagliflozin. These medications help lower blood sugar by causing the kidneys to excrete more glucose through urine. GLP-1 receptor agonists, such as liraglutide and semaglutide. These medications work by increasing insulin production, reducing appetite, and slowing the absorption of food in the stomach. Insulin. For people with type 1 diabetes or advanced type 2 diabetes, insulin therapy is often necessary. It helps regulate blood sugar levels by delivering insulin directly into the body when the pancreas is unable to produce enough. How to use medications effectively. Work closely with your healthcare provider to determine which medication or combination of medications is best for you based on your blood sugar levels, lifestyle, and health goals. Monitor your blood sugar regularly while on medication to ensure your levels remain within the desired range. Be consistent with your medication regimen to avoid fluctuations in blood sugar and optimize its effectiveness. 2. Incorporating supplements to support diabetes management. In addition to prescription medications, certain supplements can help improve blood sugar control and overall health. While supplements should never replace a balanced diet or medical treatments, they can provide additional support for lowering A1C and improving insulin sensitivity. Beneficial supplements for diabetes. Cinnamon. Some studies suggest that cinnamon may help improve insulin sensitivity and lower blood sugar levels by mimicking insulin's action. Alpha-lipoic acid, ALA. A potent antioxidant, ALA has been shown to reduce insulin resistance and improve blood sugar control, especially in people with neuropathy, nerve damage caused by diabetes. Magnesium. Magnesium deficiency is common in people with diabetes, and supplementing with magnesium may help improve insulin sensitivity and blood sugar regulation. Berberine. This natural compound has been shown to lower blood sugar levels and improve insulin sensitivity, especially in people with type 2 diabetes. Vitamin D. Low vitamin D levels have been associated with an increased risk of type 2 diabetes, and supplementing with vitamin D can support insulin function and reduce inflammation. How to use supplements effectively. Always consult your healthcare provider before starting any new supplements, as they may interact with other medications or conditions. Research the proper dosages and forms of supplements that work best for your individual needs. Incorporate them gradually into your routine alongside a balanced diet, rather than relying solely on supplements for blood sugar control. 3. Behavioral and lifestyle changes for sustained diabetes control. Beyond diet and exercise, there are behavioral and lifestyle changes that can have a profound impact on your ability to manage diabetes and maintain a healthy A1C level. These changes support long-term success by helping you stay consistent, motivated, and focused on your health. Behavioral strategies to support diabetes management. Set realistic goals. Instead of overwhelming yourself with the desire for rapid changes, set small, achievable goals each week. Whether it's adding a new vegetable to your meals or walking 10 more minutes a day, these small steps add up over time. Build a support system. Having a strong support network of family, friends, or support groups can keep you motivated and provide emotional encouragement as you manage your diabetes. Consider joining a diabetes support group, either in person or online, to share experiences, tips, and strategies. Use technology. There are many apps and devices designed to help manage diabetes, from glucose monitoring systems and insulin pumps to meal tracking apps. These tools can help you stay on top of your diabetes care and keep your blood sugar levels in check. Work with a diabetes coach or educator. A diabetes educator can teach you essential skills for managing your condition, such as how to manage blood sugar fluctuations, how to calculate carbs, and how to manage emotional stress related to diabetes. Tips for consistency. Track progress by keeping a journal or using an app to record blood sugar readings, meals, exercise, and medications. Celebrate small victories, whether it's a drop in your A1C or sticking to your healthy habits for a week. Positive reinforcement can keep you motivated. Avoid perfectionism. There will be ups and downs in your diabetes management journey, and it's okay to make mistakes. The key is to stay consistent and learn from any challenges that arise. 4. In-depth stress management for lowering A1C. Stress can wreak havoc on blood sugar levels, causing them to spike or fluctuate. Managing stress is essential for lowering A1C and preventing unnecessary blood sugar imbalances. Chronic stress causes your body to produce more cortisol, a stress hormone that can increase blood sugar levels by stimulating the liver to release glucose. Effective stress management techniques. Mindfulness meditation. Regular mindfulness practices can reduce cortisol levels and improve blood sugar control. Progressive muscle relaxation. This technique involves tensing and relaxing muscle groups to reduce physical tension caused by stress. Deep breathing exercises. Practicing deep, slow breaths can activate the parasympathetic nervous system, which promotes relaxation and helps lower blood sugar. Spending time in nature. A simple walk in the park or spending time outdoors can significantly reduce stress and lower blood sugar levels. 5. Get professional support. Regular checkups and adjustments. Even with all of the strategies mentioned above, it's crucial to work with your healthcare provider regularly to monitor your progress. Your doctor will be able to adjust your treatment plan, medications, and lifestyle recommendations as needed to ensure that your A1C remains within your target range. How to stay engaged with your healthcare provider. Schedule regular checkups with your primary care doctor or endocrinologist to track your blood sugar levels and A1C. Discuss any changes in symptoms, medications, or lifestyle that could impact your diabetes management. Collaborate on adjustments. If your A1C is not within the desired range, your doctor can suggest medication adjustments or more intensive monitoring. What to expect from better diabetes management. By implementing daily habits and long-term strategies for managing diabetes, you can expect several positive outcomes over time. 1. Lower A1C. Through consistent monitoring, healthy eating, regular exercise, and stress management, you should begin to see your A1C drop toward your target range. 2. More stable blood sugar. With improved habits, your blood sugar levels will become more predictable, leading to fewer spikes and crashes throughout the day. 3. Improved overall health. Managing your blood sugar effectively will lower your risk of diabetes complications, including heart disease, kidney disease, and neuropathy. 4. Better quality of life. With consistent diabetes management, you'll feel more energized, less stressed, and more in control of your health. Empower yourself to manage diabetes and lower your A1C. Managing diabetes and lowering your A1C is within your reach. By implementing small, sustainable changes to your lifestyle, you can take control of your health and lower your A1C over time. Whether it's through dietary adjustments, exercise, stress management, or medications, the key is consistency. Remember, diabetes management isn't about perfection. It's about progress. The small steps you take today will add up to big improvements in your health tomorrow. Stay patient, stay committed, and know that better diabetes management is possible. Thank you for watching, and take the first step today towards a healthier, happier you.